The job description of a patient care technician encompasses providing essential support to medical staff and delivering direct care to patients in various healthcare settings. These professionals play a vital role in enhancing the patient experience by attending to both clinical and non-clinical needs. Patient care technicians, PCTs, are often found in hospitals, nursing homes, rehabilitation centers, and outpatient clinics, where they contribute to patient recovery, comfort, and well-being. PCTs act as a bridge between patients and healthcare professionals by ensuring that physicians and nurses have accurate, timely information. Their responsibilities can vary depending on the facility, but they are universally expected to maintain high standards of care, professionalism, and empathy. The job demands a combination of technical knowledge and interpersonal skills, as PCTs work closely with patients who may be vulnerable or in distress. Some patient care technician roles are full-time, while others may be part-time or shift-based. Regardless of the arrangement, PCTs are expected to be dependable, responsive, and capable of managing multiple tasks in a fast-paced environment. Their role is fundamental to the overall functioning of a healthcare team and directly impacts patient outcomes. Primary responsibilities of a patient care technician. Patient care technicians perform a wide range of duties that center around patient support and medical assistance. A core responsibility is monitoring patients' vital signs, such as blood pressure, heart rate, temperature, and respiration. PCTs must be proficient in using diagnostic tools and understanding normal versus abnormal readings so they can promptly alert nursing staff to any concerning changes. Another major duty includes assisting patients with activities of daily living, ADLs, which may involve bathing, dressing, grooming, and feeding. For patients with limited mobility, PCTs help with repositioning in bed, transferring between beds and wheelchairs, and walking with support. These tasks require physical stamina and a strong sense of compassion, as they significantly affect patient dignity and quality of life. In many facilities, PCTs are responsible for collecting specimens such as urine, blood, or stool for laboratory testing. They must follow strict protocols to ensure the accuracy and integrity of the samples while adhering to infection control procedures. PCTs may also perform electrocardiograms, EKGs, monitor blood glucose levels, or administer catheter care under supervision. Maintaining accurate records is an integral part of the job description. PCTs document patient observations, input, output levels, and responses to care in medical charts or digital health systems. These records assist the broader healthcare team in developing or adjusting treatment plans. Beyond clinical tasks, PCTs provide emotional support and companionship to patients, many of whom may feel isolated or anxious. Simple acts like conversing, listening, or offering comfort can profoundly affect patient morale and recovery. Essential skills and qualities for the role. To excel as a patient care technician, individuals must possess a robust set of soft and technical skills. Foremost among these is empathy. PCTs often work with patients in pain, undergoing procedures, or dealing with life-altering diagnoses. The ability to show compassion and understanding is crucial. Communication skills are equally important. PCTs must effectively relay patient information to nurses, doctors, and other staff while also listening carefully to patients' concerns. Clarity, patience, and professionalism in communication help ensure optimal care delivery. Technical competence is vital in operating medical devices and documenting information accurately. PCTs must be trained to use blood pressure cuffs, thermometers, glucose monitors, and other tools correctly and efficiently. Physical endurance is another key attribute. The role often requires long hours of standing, walking, lifting, or assisting with physical activities. Good stamina and strength are necessary to meet the physical demands safely. PCTs must also be detail-oriented, as they are responsible for monitoring patient conditions, administering basic procedures, and recording information with precision. A lapse in attention can lead to errors that compromise patient safety. Reliability and a sense of accountability round out the essential qualities of a strong patient care technician. Supervisors rely on PCTs to be punctual, consistent, and conscientious in all duties. Ethical behavior, respect for patient confidentiality, and adherence to safety guidelines are non-negotiable aspects of this role. Work environment and challenges. Patient care technicians work in environments that can be both rewarding and demanding. Their work settings are typically healthcare facilities with strict regulations and fast-paced operations. The environment can range from bustling emergency departments to quieter long-term care units. The physical aspect of the job is intense. PCTs often work on their feet for extended periods and may be required to lift or move patients. Personal protective equipment, PPE, is commonly worn, particularly when dealing with infectious diseases or during medical procedures. Schedules can include nights, weekends, and holidays since patient care is a 24/7 responsibility. This can be challenging for those balancing work with personal responsibilities. However, it also offers flexibility in shift options, which some individuals may find beneficial. Emotionally, the job can be taxing. PCTs may witness patient suffering, confront medical emergencies, or deal with loss. Developing emotional resilience and knowing when to seek support are important for long-term success in the role. Despite these challenges, the role is deeply meaningful. Many PCTs find satisfaction in helping others, witnessing recovery progress, and forming genuine connections with patients. The job can also serve as a stepping stone to more advanced healthcare careers, such as nursing or medical technology. Midway through understanding this multifaceted role, it's essential to recognize that the job description of a patient care technician encompasses more than just basic care. It's about serving as a compassionate presence, a reliable support system, and a crucial member of the healthcare team. Educational requirements and training. Most employers require a high school diploma or equivalent for entry into patient care technician roles. However, candidates typically must also complete a certified training program, which can be offered through vocational schools, community colleges, or healthcare institutions. These programs often cover anatomy, physiology, medical terminology, infection control, and clinical skills. After completing training, aspiring PCTs may pursue certification to improve job prospects. One of the most recognized credentials is the Certified Patient Care Technician, Assistant, CPCT-A, designation offered by the National Health Career Association, NHA. Certification demonstrates a standardized level of competence and can increase employment opportunities. Many healthcare facilities provide on-the-job training to familiarize new hires with specific procedures, technologies, and patient populations. Continuing education may also be required to maintain certification and keep up with evolving healthcare standards. Some PCTs choose to expand their qualifications by earning additional certifications in phlebotomy, EKG administration, or basic life support, BLS, which can broaden their scope of work and enhance career growth. Conclusion. The job description of a patient care technician outlines a dynamic and essential role within the healthcare system. These professionals are the backbone of patient support services, ensuring that individuals receive attentive, empathetic, and efficient care throughout their medical journey. PCTs are not only trained caregivers but also compassionate advocates for patient well-being. They handle a diverse array of tasks, from clinical monitoring to emotional reassurance, making them indispensable to hospitals and care centers. For individuals passionate about healthcare, service, and hands-on work, becoming a patient care technician offers a fulfilling career path with numerous opportunities for development. In this role, one doesn't just provide care, they make a meaningful difference in the lives of those they serve.